Speaking of different models, Mike, once again, we've received a lot of email questions from our listeners, many of whom are interested in the different approach that Sweden has taken to fighting the coronavirus. So, Tamara asks, what are your thoughts on Sweden's decision not to impose a complete lockdown? And is it that their population is healthy enough that they can do this?
The Sweden situation has been unfortunately mischaracterized by many as a experience, and it's not that at all. When we look back on what Sweden originally did, they did not do all the social distancing, as has been called by them. I continue to call it physical distancing. They left bars and restaurants open with some distancing there. Schools remained open. And for the longest period, from February into towards the end of March, everyone said, look at the rates of disease, the rates of deaths in Sweden, Denmark, Norway, and Finland are all the same. And yet those other three countries were ones that put into place much more stringent distancing recommendations, much like we had had in the United States. Well, then in March, the four countries diverged. Denmark, Norway, and Finland continued to show a certain increase, much more gradual in number of cases and deaths, and Sweden took off. Such that by the end of April, Sweden was very, very different than the other three countries. They now have, as a country of 10,333,000 people, 27,272 cases of in COVID infection. That includes 3,313 deaths as of today. Their rate of deaths, 32 per 100,000, even exceeds the United States of 24.7 per 100,000. Over 70% of those deaths were in long-term care facilities, for which there now has been a criminal investigation opened about the actual transmission in those long-term care facilities and what the implications are. Meanwhile, as you look at the overall rate, as I pointed out, the 32 per 100,000 deaths, that compares to 9 per 100,000 in Denmark, 4 per 100,000 in Norway, and 5 per 100,000 in Finland. Substantially below what Sweden had seen. Even if you look at just general cases, their rate of cases per 100,000, their 27,000 I mentioned, is at 263 per 100,000, whereas if you look at the others, they range between 108 and 181 per 100,000 in terms of Finland, Norway, and Denmark. So I don't see anything magical about Sweden. Now, there's been one additional claim, however, that they are on their way to developing herd immunity, this idea of 60 to 70%. And I've actually had the opportunity to see some of the seroprevalence data that has been coming out of Sweden over the course of the last 2 weeks, including a recent study report on healthcare workers. I've seen no data that supports that there's more than 20% of the population of Sweden who previously had this infection, i.e. trying to get to that 60 to 70% herd immunity. They are a long, long ways from achieving that. So to me, this is another example where we all want an answer that works, something that is not so bad to do and surely not so bad with the disease. This unfortunately doesn't work here. This is, again, biologic physics at work. This virus is going to do what it's going to do. It may take a different time course than some countries versus others. It may take a different route of who it infects first in terms of at-risk populations, but it's going to do what it's going to do. And I hope that the Sweden example will cause everyone to take pause and just step back and say, okay, now what really is happening here? There are no easy answers here. There's no easy outs. I hope the concept of the Sweden model is now gone. It's done. People realize it's not what everyone thought it was, and it's not going to be that going forward. And it just means that we're going to be in this slug together without an easy answer.